So hi, I'm Dr. Sally Foote. I am a veterinarian with over 35 years of veterinary experience practicing, owning my own practice with a focus on low-stress veterinary care. I'm also now a speaker, writer, and expert in veterinary behavior, especially for helping to make it better for care, giving plans for clients, also, and nipping a lot of behavior problems in the blood. In the bud. So today's topic is calm arrival. So as part of that like 5-step plan for helping dogs and cats to have a better, less stressful care experience. Like last week I talked about, the meds and if people are resistant to giving meds. But this week I'm talking about calm arrival. We want the animal to come and arrive at the veterinary clinic in a calm state. All right, so where does all this start? It starts at home. And here's the thing that I never really realized until I got more into this and asked more questions from clients or, what is it really like to help your pet get ready to come to the vet? And so there are a lot of, different handouts and videos, etc., to describe how to make it easier for the cat to like the carrier. We actually lack a lot of this information for our dogs, specific steps, but it starts at home. And even so at home, what we really need to know is, first of all, for this pet, dog or cat, what is it like for them to get into, whether it's a carrier, have the leash attached, the harness attached. So that's the preparation, right? The prep for coming to the vet. What is that like? So in my top 5 low stress handling technique courses, my first technique is really clearly understanding and reading body language for brewing fear and aggression. And I instruct you to have these handouts posted in your veterinary clinics wherever a pet is and give these to clients. Okay, this is the cat first step. This is the feline ladder of aggression, which shows how they go from being fearful and then go up to biting, swatting, and hissing. And this is the images. This is what the cats look like when they're in these lower levels of anxiety. So the clients need to have this. Or at least if the client says, oh, he's horrible to get in the carrier, you pull these out and you say, point to me, point on this picture what your cat looks like when you get the carrier out. Or how are you trying to get the cat in the carrier? And if they then say, oh my gosh, he's trying to bite me, he's swatting. Okay, so he's already up here at aggression for the sight of the carrier, for trying to put him in. And at that level, if we need to do immediate care, we as veterinary staff members, doctors and technicians need to say, he needs medication to be able to be more mentally calm so that he can be calm for arrival. His preparation, he's just way too upset. Yes, you can work on counter conditioning, but for a cat who's that agitated, as my example, it's going to take weeks of not just having the carrier out, and you don't just set the food in the carrier. You've got to toss the food around the carrier. You've got to make it in and out games. We have to try a different carrier. So right in that moment, I also need to know, is this something we need to get him in for care and exam within a day? Is he ill? Is he sick? Is he injured? Do we have a chronic health condition we're trying to manage? So we're going to need to recheck him in a week. Okay, I need to know that because medication facilitates or helps their learning. So that calm preparation is important because, and this is the chart for the dogs. Dogs, same idea. They go up from yawning, nose licking, turning away. Those are all those early signs of anxiety. And as if they're doing that at home, then when they're riding in the car, okay, that's the travel. Now we have to have calm travel. The traffic going by, the sound of the engine and the motor, and the pets they do know the route to the veterinary clinic. They remember it. They look at the landmarks. They see the gas station, they see whoever's house, etc. And so they are increasing then in this anxiety. It's building up in the car ride over. Even if they're laying down in the seat, that may be actually they're laying down, hunkering down and hiding in the back seat because they're trying to not see and they're trying to self-eliminate these triggers. So they're actually getting more anxious on the car ride. That may be so. And so again, I need to know exactly what does your dog look like when he's riding in the car. Tell me so that I can really understand what his behavior is so that I can help you maybe decrease that, or if we need medication. Okay, so calm, calm preparation, calm travel, then arrival. Where is this dog or cat landing? Okay, I want you to think of it kind of like an airplane. You know, the pilot and the crew prepare the plane for takeoff. And they better make sure they've got everything in place and they've got it in the right place and everybody's calm, right, when you're getting ready for takeoff. And we want the takeoff to be calm and direct, not erratic and chaotic, and we want the landing that way too. So landing at the vet clinic, where is the animal going to land? Are you pulling in a parking lot right there with 5 or 8 other people coming and going in and out of the parking lot? Is your car facing traffic that is going by and very noisy, or can you face the, you know, does that, as your animal, whether it's a dog getting out of the car, do they start pulling and tugging at the leash? That pulling and tugging at the leash, while it looks like they're excited to be at the veterinary clinic, and they may be, that physical movement and agitation can increase the ability for them to shift over to stress, or shift over sometimes to more anxious or even aggressive behaviors. So we want them, while they may be happy, I want 4 feet on the floor from those dogs. I want them walking in without pulling or dragging people around or jumping up or barking. When dogs are barking at other dogs, that's a big agitator for the dogs. It's also an indication of inter-dog aggression. So I don't see that. We don't, the veterinary staff doesn't see what's happening out there in the parking lot. And the parking lot can oftentimes be, everything's really cool and great until you arrive in the parking lot, and then they're getting kind of worked up. So we need to know what are they like in the parking lot to then give you advice on as for what to do. And then, of course, coming into the office, and as we go into the office, this is where the veterinary staff can actually take a lot more control and direct guidance to our owners. As soon as they come into the door, or if you're still doing curbside and you go to the car to escort your client directly in, you want to be tossing rewards to that dog, or cover the carrier for that cat with a blanket to decrease that flying through the air feeling, which can have the cats get agitated a little bit, like hiding more in the carrier. Think of that. Think of it through the animal's eyes. So veterinary staff, be very forward, be proactive. Have the pheromones on that towel, on the bandana. Have your treats in your pocket at all times so you can immediately reward these dogs and get them in the exam room, and then continue that rewarding low stress care while they're in the exam room, and watch how the animal's response is. Remember, go back to that first of my top 5 low stress handling techniques. Okay, here are some specific tips, especially this calm arrival is primarily dependent on you, the pet owner, to get that animal prepared and have them accustomed to travel to the veterinary clinic and arrival. Because you see, all that is happening at home and on the way to the vet clinic. All that I can do as a veterinarian, or any technician, assistant, or veterinary staff member can really do is give you advice on how to do this, and then of course supplement or drug us, provide it, but you are the one who has to give it according to the recommended, medication schedule. Do the practice to prep the pet, and then lastly, tell us how were they for prep, how calm were they for travel, and how were they really out there in that parking lot to help us help you. Okay, specific tips. Let's go back to preparation. Number 1, make sure the house is calm. I posted once on my Facebook page asking other practitioners, what do you think, kind of interferes with this getting the pet prep to come to the vet clinic? What do you guys find is like the hardest thing, to help clients with and such? And a lot of them said, oh my gosh, the rushed or stressed owner who has done 4 errands before coming to the vet clinic with 3 children in tow, or, there was just a lot of activity about loading up the animal, driving in, and getting there, okay? So, pet owners, calm preparation. So therefore, please tell us the best time of day when it may be less chaotic for you at home to be able to prep, get your dog or your cat in the carrier loaded and bring them to the veterinarian. If within your life between 10 a.m. and 2 p.m. is when you do not have to have, say, your children around or aging parents to take care of or things like this, then yes, we can work with you on accommodating, that for scheduling your appointments. We'll probably need more notice. You'll probably need to call us a few weeks in advance of when you need care so we can make sure to fit you in at that time. I also had another client, I didn't realize it till we had this dog on meds, and this dog was more agitated than ever on the medication. And I asked the client, did you give the meds? Yes, I gave the meds. Did anything get her upset? Oh yes, the UPS driver went by and my dog goes bonkers about the UPS drivers. Well, medication cannot stop all agitation and anxiety. So when this dog saw the UPS driver half an hour before coming to my office, she was still kind of worked up. That's why the meds weren't working. So we put a flag on her record and told the client, then we have to schedule her before 11 a.m. because the UPS deliveries happen in town somewhere between noon and 1 p.m. Okay, so fine, that's how we would schedule this dog, and we would have enough warning. And if this dog ever really needed to come in for care, where she may have seen the UPS driver, at least we understood why, and we would take extra measures for stripping down any and all noise agitation that may bother her. Okay, so calm prep. In our cats, we have to stay calm. Boy, if there is ever a sponge for our emotions, it is the cat and the horse. So try to stay as calm yourself. Having tools like a towel handy, and practice this at home when you're not needing to load your kitty up or your dog into the car. Okay, so just practice with your kitty. Just throw a little towel over, take it off, give them a spoonful of tuna. Simple as that. And then you could do it again. And the purpose is that if I needed to get this cat in a carrier that he was really slow to get accustomed to, but I need a hard shell carrier for safety for driving, I want this cat to be calm about having his head and body covered, because so now as I pick him up, he will not see that he's going in the carrier, and this blocks the trigger. And that's how it decreases his anxiety. And when I put him in the carrier, I'm going to leave that on him. I want him to stay covered in the carrier so that he's not as agitated from the traffic whizzing by and then picking up the carrier and having to bring him into the veterinary clinic. Of course, you will spray this with the Feel Away pheromone spray. Okay, so that's your tips on preparation steps to stay calm. Travel. All right, be mindful of traveling. And I'm serious, take your dog, take your cat on a little ride to the vet clinic on a Sunday afternoon when nobody's around. All you have to do is drive them to the vet clinic, toss them some treats, put some tuna, some chicken in the cat carrier for your cat, throw some nuggets of the best treats in the back seat for the dog to be searching and finding them as you drive to the vet clinic, sit in the parking lot for a few minutes, and just drive home. Repeat this a few times until the dog is like, wow, yeah, I can't wait to go to the vet clinic, because now this is how you're getting the drive to be more calm for them. Then pull up to my clinic on a day that they're open for business, and again, just drive up, throw food to the dog, and leave. Because now the dog has to see all these other people and dogs around to get accustomed to that level. And this is how you build up the travel, calmness for travel. You might have to change your route. It might mean that instead of taking some main busy roads, you're going to be taking quieter neighborhoods. It's worthwhile to do this, and please do this, because that calm arrival is so important. Now, lastly, getting out of the vehicle, going on to, come into the clinic, or especially veterinary staff, if you're still coming to the car, kind of at a modified curbside, make sure that you either have treats to toss to the animal, your leash handling skills, proper approach from those top 5 low stress handling skills. Of course I have, okay? Because they may get agitated about a person approaching the car. So it might mean, okay, Tech stays 10, 12 feet back and says to the owner, okay, you get him out of the car, and now once he's out of the car, then I can approach him. Okay, the dog may be much better when they're out of the car than when they're in the car, and make those notes on the medical record. Okay, when it comes to medication and supplements, they can work, yes. So some of it is a little bit of trial and error, but it's important that the animals have these to help if they need them, such that it can help them be in this calm state so that we can start things off in the right way and build on that for the remainder of the veterinary exam. And as the animals learn, they come for these practice Sunday drives, as I call them, and practicing at home, just being calm at home, and better scheduling times. Oftentimes we can wean the pets off the medication because they've been put on medication doesn't mean that they have to stay on it for every single vet exam. If the client is doing this homework and being a part of the care equation, then many of these animals will be much more easier to handle, safer to handle, less anxious themselves, and they can come off of these medications and maybe go to only a supplement or reduce the amount of the supplement. So clients, I really appreciate the help that you give us, but and please continue to do so and stay in good communication with us and paint us the picture of what it's like to help your pet. Try to come to the veterinarian so that we can help you. Thank you very much. I appreciate your time. Please go to my YouTube channel and subscribe there, Dr. Sally J. Foote. I have a lot of videos showing how to get the dog in the car who's reluctant to get into the car, how to get a reluctant cat into the carrier who's reluctant to go into the carrier, reading these body language charts accurately so you can report and know what's happening right then and think of removing those triggers, etc. I'm looking forward to speaking this weekend in San Jose, California at the SAGE Symposium. And then I will be at the Illinois State Veterinary Medical Association convention with a booth where you can find out more about my veterinary staff training, online education, and other veterinary behavior solutions for the veterinary team at my booth. Thanks so much and have a great day. Bye-bye.